Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day, Monday through Friday this week at noon for this update, which is number 43, coming to you live on Tuesday, May 12, 2020 at 12 noon. This forum is being brought to you live by PAC TV at Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. And for questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today, Ken Tavares, Matt Muratore, and I are joined by Melissa Arrighi. She is the Plymouth Town Manager. Also, Edward Bradley. He is the Plymouth Fire Chief. Christopher Smalley, the Senior Director of Marketing and Communications, Beth Israel Deaconess Hospital. Thomas Marr, he's the Airport Manager. And Ann Slusser is the Recreation Director. Michelle Brady is the Director of Elder Affairs for the town of Plymouth. Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. And we're going to start with the Chair of the Plymouth Board of Selectmen, Ken Tavares. Welcome, Ken.
Steve, good afternoon, everyone. I'm going to be very quick because we have so many from the town today on the panel that I know there's a lot of information that they want to pass on to everyone. I'm doing the bidding once again for our town clerk, Lawrence Pizer. Larry would like you to know that his telephone number is 508-322-3302. If you have any questions about the upcoming election, which will be a week from today, please call Mr. Pizer at this number. He does answer. Also, Mr. Pizer would like to put out a call for folks that would like to work the polls. We have a number of openings that he would like to fill. So if you, again, would like to help out, call Mr. Pizer at 508-322-3302. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. We now welcome back our Town Manager, Melissa Arrighi. Melissa, are you still busy?
Yeah, well, that's an understatement. I don't even know how to respond to that. Yeah, I think a lot of our focus still centers on the public health department. We just established a great coordination with the school nurses working through Superintendent Maestas and Carolyn Rains, who's been a nurse at the school system that's been helping us for a while. And then with the public health focus, we still have three things that are really front and center right now. One is next Tuesday's election. It's a lot of work to do. It's quite a bit to manage with also trying to put the protections in place. We're in serious conversations now about the reopening of the beaches because we know that's going to happen and we need to be ready for it. So we're looking at a couple dates for that coming up in mid-June and some others towards the end of June. Nothing on recreational areas yet. And then finally, we're relying pretty heavily on the group that Amy Chambers, that the Chamber of Commerce is working through, Amy Naples, when it comes to what we can do for our restaurants and businesses. So that's really our circle of focus at the moment.
Thank you. Melissa Arrighi is Plymouth Town Manager. She'll be here for your questions. Email us, plymouthinfo@pactv.org. We're now going to go to Edward Bradley. He is the Plymouth Fire Chief. Welcome back, Ed.
Good afternoon. Thank you for having us here. The Plymouth Fire Department continues operations as it was prior to the epidemic. We're still seeing the same number of calls for service as we typically would in March, April, May time of year. Just the calls are a little bit different. We had seen a decrease in motor vehicle accidents until this last week. They seem to have picked up, but we had gotten some other types of calls. People working around the homes, hauling off ladders, trying to clean gutters, chainsaw accidents, and some power tool incidents. But even though the business office is closed, the business still continues on. The only things that we have not been able to do, and it was part of the order from the governor, was we are holding back on any of the inspections on the sale or transfer of any property. That will open up at the end of the emergency or whenever the governor takes this order out of effect. And basically, there was some couple of procedures that a buyer and seller can get into and still make the sale happen. There's just some paperwork and documentation that they have to fill out. And some of the banks and lenders have been requiring some money to be held back at the sale just to make sure that the smoke detectors and carbon monoxide detectors do get installed and they do get inspected at some point in time. And you know, the fire department, I don't know if anyone's been by the Beth Israel Deaconess Hospital on Sandwich Street. You may have noticed that there's a tent set up in the parking lot there where they're doing some testing. Fire department was, as other town departments, helped up with that, setting up that site. As a matter of fact, we supplied a lot of the equipment that you see there being used, like the generator, the lighting equipment, the message board that scrolls the instructions for the patients that are waiting to be tested, and heaters for the tents, and as well as a wireless access point so that the nurses and doctors working at that site had seamless connection to the hospital's system. As the governor put an order in for masks, I released some information on masks, do's and don'ts. It was picked up by the Old Colony and published. It's also on Wicked Local. We will get it up on our websites. And it's just some pointers to people that have probably never worn masks before. We kind of take it for granted because we're using protective equipment all the time, but there are people that have never had to use a mask or any of this PPE before, and they had a lot of questions on exactly how to proceed with it. We also issued an order that we will not be issuing any bonfire permits this year. And the reason for that is that the smoke from any type of fire, and I've also asked that any non-essential burning not happen. Any of the smoke that can cause any irritants to the throat and lungs to people can also mimic some COVID-19 symptoms that could have people going out to be tested for no reason. And it can irritate that system, so your breathing system, so that they're easier to catch the COVID virus. So we're asking people not to be doing any outdoor burning. This is not something that's going to help the situation along at all. And as a result, we will not issue any bonfire permits this year. As you know, last week, the town buildings opened to some of the employees. The staff was showing up on a split schedule. One of the assignments for the firefighters has been to be at each of those locations, those 3 locations, the Center for Active Living, the library, and a town hall at the time when the staff shows up, and they're screening all the staff before they enter the building and checking their temperature using infrared thermometers, and just ensuring that there are nobody eating in the building that may have some symptoms that could cause a spread of the virus in the building. And that's about it for my report right now.
Thank you. Plymouth Fire Chief Edward Bradley, he'll be here to answer your questions. PlymouthInfo@pactv.org each Tuesday now. We also welcome Christopher Smalley. He is the Director of Marketing and Communications at Beth Israel Deaconess. Welcome, Chris.
Welcome. Thank you, Steve, and hello to everybody else on the panel. Just like to reiterate what Chief Bradley was saying, and a big thank you to his department and all the town departments and the elected officials that are on this call right now for all the help and collaboration that we've received from you, Chief Bradley, and the other members. 4-hour drive-through testing and just COVID-19 preparedness in general. It really does take a village to make all of this work. Just switching gears briefly, I know that there's a lot of panel members here. A couple of things to point out for the hospital, and this is around the country. This week actually represents National Hospital Week, and that's through the American Hospital Association. And their tagline, if you will, is where health comes first. And when you think of a COVID-19 pandemic and everything that all of you on this panel have been doing to protect the health of the community, it really does take everyone to push back COVID-19. Related to the hospital, just a big thank you to all of our 2,000 employees who show up to work every day on the front lines, and a special thank you to all of our support staff at the hospital. Support staff would be housekeeping, food service, transport, security, facilities. They're all allowing the nurses and the doctors and the clinicians and the technicians to do their work and to do it very, very well. Representative Muratore will probably bring up some numbers when he's on, but by the numbers specifically at the hospital, 39 positive cases of COVID-19 inpatient and 26 suspected cases that could be positive. There's also more than 60 patients, COVID positive, have been discharged to date over the last 8 or 9 weeks. So that's a number that we're looking at. And there's a certain sense of celebration as those patients are able to go home safely. Like the town of Plymouth and other organizations, we're in the very, very early stages of what we call recovery planning, both at the system level and at the hospital level, how to reopen the hospital and various departments at the appropriate time. So that's some very early conversations that are now taking place at the hospital, and we'll be able to update the community as we learn more and plan for that in the coming weeks. And again, thank you to all the people in the community for your ongoing support, your donations to our Healthcare Heroes Fund, donations of food, signage that appears on our hospital grounds on a regular basis. All of that means a lot to the employees who work at the hospital. And that's the quick update. Knowing there's a lot of people on the panel, look forward to any questions that may arise toward the end of the show.
Thank you. And that is Christopher Smalley. He is the Senior Director of Marketing and Communications at Beth Israel Deaconess Hospital. At this time, we welcome back the Airport Manager, Thomas Marr. Welcome, Tom.
Good afternoon, everyone. Thank you, Steve. The Plymouth Airport continues to function as a gateway into the community, very much like a highway. And we continue to be open 7 days a week, normal hours as far as staffing is concerned. So throughout this health emergency, we've been able to continue to function with reduced staff for safety reasons, but we continue to operate. Our operations have been running in the area of about 35% of what they normally would be this time of year, so it's clearly very slowed down. One of our major functions for being here during 7 days a week has certainly been to service some of the healthcare providers and emergency operations aircraft that function out of the Plymouth Airport. Boston Medflight continues to be one of our major operators here at the Plymouth Airport. They've been they've been typically running in the order of about 7 flights per day. As you can imagine, they have to take extra time in reference to disinfecting the aircraft between flights, but they continue to service all of southeastern Massachusetts, Cape and Islands, and places of that nature. One of the other major tenants here at the airport is the Massachusetts State Police Air Wing. They're headquartered here at the Plymouth Airport. So they've been running on average something in the order of around 3 to 5 flights per day, depending on the nature of the requirements within the state of Massachusetts. There are 3 bases in the state: Lawrence Airport, Westfield Airport, and then it's headquartered here at the Plymouth Airport. So there's a staff of approximately 6 or 7 people here throughout the day. Another activity that has been ongoing for the last 2.5 weeks is the Plymouth County Mosquito Control Aircraft has been doing their spring larvicide spraying. It's a pellet that they put into the wetland areas. That is something that is a part of the Plymouth County Mosquito Control Program. And they operate from about 6 in the morning until about 8:30 in the morning when the winds are light. So if you see a red and white airplane flying very low over some wet areas, that is Plymouth County Mosquito Control. They typically will fly during the month of April in towards the end of the month of May, and then there's a break. And typically, if there's any additional spraying, it would be later in the summer season. So the airport staff has been here primarily to service those types of aircraft, but the airport continues to be open. So it's just like a highway, and other aircraft are able to come and go as need be. I think one of the more interesting activities throughout this emergency situation has been the volunteer flights of one of our base pilots. We have a gentleman by the name of Mark Hansen, who has his small jet based here at the Plymouth Airport. And he does patient airlift flights, which he donates on his own. But in the last couple of weeks, he's also been doing bone marrow transports around the country, including in some cases internationally. And Mark has been a big supporter of the airport. He's done over 250 of these volunteer flights, which he pays for himself in his small jet. And it's really a fascinating aspect of aviation and how we're able to assist in getting both patients to specific hospitals, but then also, as I noted earlier, bone marrow from one place to another within the window of opportunity, because it is so very, very time sensitive. The flight schools here at the airport have been closed throughout this emergency. Obviously, they hope to be able to reopen at some point when the governor deems it appropriate. And that includes Cape Cod Community College and their 75 students. They've been doing remote learning for the past month and a half, but they're starting to run out of things that they can do officially online and hope to be able to get back and do actual work on aircraft here at the Plymouth Airport. And I look forward to any questions anybody might have at the end of this. And that's pretty much the update of the airport.
Thank you, Thomas Marr. He is the airport manager. Today we welcome a new participant to our panel, Ann Slusser. She's the recreation director for the town of Plymouth. Welcome, Ann. And what can you tell us about recreation coming up this summer for Plymouth?
Hi, thanks for having me. So the Town of Plymouth Rec Department, we are currently putting together some new summer programs. They'll look a little different than maybe some of the typical programs that we offered in the past, but we are going to have activities for everyone this summer. We've been putting activities on our Facebook page. So if you haven't liked our Facebook page yet, it's Plymouth Recreation Department. We've been posting cooking activities, fitness activities, arts and crafts, different ways Junior MBA has gotten people moving, and certain tennis activities you could do from home. This summer, we're looking at doing maybe some like karate, archery, activities that still practice social distancing where you don't have to be right next to each other. We've looked at some virtual online classes as well. From like knitting and science programs. We're hoping to launch an esports program this summer with the various video game systems, whether it's Xbox or PlayStation, and ways for people to compete against each other. And that way, we've also been posting a lot of updates on our website. If you don't know it, it's PlymouthRec.com. So PlymouthRec.com. We've been posting a lot of our updates on there as well. Park closures, park openings, beach openings when we do have those dates. We'll post all that information right on our homepage. We're still in the midst of hiring for lifeguards, parking attendants. So you can apply for those jobs right on the Town of Plymouth website under the Human Resources link. We've been doing interviews via Zoom, phone interviews. We're still figuring out training from Red Cross for our lifeguards. They will be a little bit different than they have been in the past, but we are still working on some of those kinks when it comes to training our staff. So we definitely been busy. It'll be a little different than what we've had in the past, but it'll still be fun and exciting for everyone, hopefully this summer.
Ann Slusser is the Town of Plymouth Recreation Director. She'll be here to answer questions. We've already got a question for her, but first we're going to go to Michelle Brady, and she's the Director of Elder Affairs for the Town of Plymouth. We welcome Michelle each Tuesday. Hi, Michelle.
Hi, Steve. How are you? Thank you.
Great.
Hello to everyone on the panel. Just a few updates. The Center for Active Living is busy, thriving, despite obviously what's going on. Wanted to make sure that seniors were aware that we are now operating with 5 major food resources in the community, because we want to ensure, obviously, my goal is to make sure all senior needs are met, especially during this time. But I want to just briefly give those 5 resources. And if for seniors listening or anybody that has any questions, call us at 508-830-4230, and we will give you specifics in regards to these resources. But briefly, the Nathan Hale Foundation has been phenomenal with seniors and veterans. They continue to supply our seniors with food and deliver food to them. Christ Church has a food pantry. They also will deliver to seniors in need. And the Second Church of Plymouth has a food pantry with offerings for our population. Second Church of Plymouth does not deliver, but we do. So we'll have volunteers if you need delivery from there. The Plymouth Sunshine Rotary Club has started a Nourish Your Neighbor program, which is pretty phenomenal. It provides a meal, it's a single meal, but to a senior or family. And that meal is featured from a local restaurant. It's no cost to you, it's delivered to you, to your door, and it's provided through generous community donations. This week happens to be Tuscany Tavern and Strega Cafe. So really phenomenal thing that the Rotary Club's doing. We also offer non-perishable senior food boxes. That is done through South Shore Community Action Council in conjunction with the Plymouth Public School Volunteer Committee. And pet supplies are given through America's Hometown Pets in Need. So those are some resources that we have in terms of food and pet supplies. Wanted to let everyone know that it is really important. The Center for Active Living is striving to ensure that seniors that need masks, particularly since it's mandated both in our town and in our state, we want to ensure that if there are seniors out there that are stressed or worried about not having a face covering, we can help provide that for them. Thus far, the Center for Active Living has provided, we're closing in on 1,000 masks being donated to seniors that have called. 400 alone have been made by the Pine Hills Volunteer Face Mask Team, and they continue to produce for us. We have our own Cynthia Sykes, who's a volunteer at Cal, 250 she's made. Peter Brown, Tiny and Sons, 100. We just keep tapping our resources, and the community has been amazing. So we're not going to stop until every senior in Plymouth that needs a mask or face covering and calls us for one, we're going to find a way to get it to them. Many people have mentioned already the voting, but I would be remiss in a senior angle, if you will. It's really important. We want our senior voice to be heard. We are encouraging you, seniors, to please utilize voting by mail. As Ken had mentioned at the beginning, if you have any questions about that process or how to do that, if we can help you execute that, call us at the center or call our town clerk directly, which Ken did give you that number, 508-322-3302. We want our seniors to do their civic duty and to be heard, but we want them to do it safely. Virtual programming, Cal is working on creating an immense amount of opportunity for virtual programming through exercise classes, lecture series, entertainers. We do Delicious and Nutritious every Friday on Zoom. We're going to be doing a lot more of this. We're looking for creative ways to bring seniors together. We recognize that not every senior has internet access. There are a number of business offering discounts and free Wi-Fi and internet access. Lifeline, AT&T, Comcast, Xfinity, call us. We'll go over some plans with you that might work for you so that you can join the virtual world. That's it for today, Steve. Thank you.
Thank you. And that's Michelle Brady. She is the Director of Elder Affairs for the town of Plymouth. She joins us each Tuesday, as does Stephen Cole, doing our economic business portion of today's presentation. He is the Executive Director of Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thanks, Steve. Glad to be back, and I'm glad for at least something regular in my life. So it's more important to me, I think, that I'm allowed back here week after week. The last couple of times I came, I shared some quotes from some folks that I thought helped kind of put in perspective all of the information that's coming at us all at once. And certainly from an economic perspective, that can be the most uncertain, the most challenging, the most nerve-wracking. back to Mark Twain. You know, I have an affinity for the lad. Something he said that stood out to me for this week is that the altar cloth of one eon is the doormat of the next. And what that means to me is that from one moment to the next, change requires us to look differently at the things we once held sacred. We have entered a new era, make no mistake about it. And as sacred to success, we used to recognize things like a full restaurant, lines out the door, turning profits that are 40% higher than what we see right now, even if those profits are 20% lower than 2 years ago. Being overstaffed and driving oneself crazy trying to balance the work schedule so everyone gets a fair share of hours. Oh, how we long for the old ways, right? The governor yesterday announced a 4-phase strategy to guide the Commonwealth's reopening. These guidelines are intended to give us clarity and focus, security and confidence that we can drop our guard a little and go back to doing some of the things that we liked to do, albeit we will be doing it a little differently. I know probably at this point I should probably secularize the conversation, but my mind goes to the governor coming down from the highest peak in the Berkshires with these commandments. I don't know what he would look like with a beard, but I think mine looks better than his would. But that's not important. That's neither here nor there. What is important is the reason we're doing this. Thou shalt not kill, right? We've heard it from the beginning. We all knew it to be true. That's the reason we're doing what we're doing, to save lives. Our values are the same, even now. And in the aftermath, they will be the same. All we need to do is take the altar cloth of old and make some face masks out of them. We're not going to get back to where we were in our economy if we don't have confidence. And I said before, at least certainly in Plymouth, it puts us in a unique position. Those folks who from our area like to travel abroad, they will be restricted from doing so moving forward, at least for the foreseeable future. We will, though, because of our behavior, instill in our potential guests and visitors a certain confidence that they can come to us because we are doing things the right way, not just in the Commonwealth, but specifically and particularly here in Plymouth. So I hope that gives some folks a little bit of quiescence to any concerns they've had. Our values are the same. What we hold sacred is the same. But that old cloth has to come off the altar, and we got to put a new one on. Thank you, Steve.
Thank you. Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. At this time, we're going to go to our Plymouth State Representative, Matthew Muratore. Matt, yesterday you told us about the governor's address that followed our presentation. And since that time, I've received more questions than answers as a result of what he said yesterday. What can you tell us today?
Sure. Let me get to that in 1 second, Steve. Let me just quickly go through the numbers. Because they're still looking very good. So first of all, the amount of testing were a little low yesterday. We increased by 6,339. Usually we're around 12,000. But regardless, we still only had an increase of confirmed cases of 669. So that's at 10.5%. With a total testing of 5.6% of the population, we're almost at 400,000. We're at 394,000 plus at this point. With regard to the amount of deaths, unfortunately, there's been an increase of another 129, which is 6.5% of those that have been confirmed with the coronavirus, which stands now at 78,462 that have been confirmed, and the total death is at 5,108. In the town of Plymouth, the total cases are 354, and we have 23 deaths, with 12 of them in long-term care facilities, 4 at BID. And 7 that came about from the contact tracing. With regard to Plymouth County, we had an increase of 75 cases from the day before. So we're at 6,457 with a total death toll in Plymouth County at 408. Chris gave you the numbers at BID. The total open beds in the Southeast region for hospitals are at 43% at this point. 11% of those are in the ICU. And open beds in the Commonwealth at the hospitals are still at 54%, with 13% in the ICU. So we still have bed capacity. We're still encouraging people. If you need to go to the hospital, it's fine to do so. Please do so. Contact your primary care. If you need the emergency room, it's fine to actually go to the hospital. There is capacity at the hospitals. With regard to the long-term care facilities, again, there are almost 700 in the Commonwealth, and to date, 639 facilities have been tested between staff as well as residents. Total amount of tests have been 38,613, and the total number of confirmed cases in long-term facilities that include nursing facilities, rest homes, and assisted livings is 16,420, and at least one there's at least one case in 336 of these facilities. And again, 60% of all the deaths that have occurred in long-term care facilities. With regard, Steve, to what you just brought up with the phases, the 4-phase approach to reopening, and that Steve mentioned as well, the goal of this is to allow for slow openings while protecting the public health, and also to limit the resurgence of the COVID-19. So the one thing that we do not want to happen, which is why we need to open slowly, is to ensure that this does not come back. If it comes back, we're in a different boat again, and that will just literally kill the economy. So we need to do this right. With regard to the 4 phases, the first phase will be the start phase, which I believe will begin on Monday, and that will be limited industries will be able to resume with restrictions. Now, those industries will be industries that will be able to safely do this. So for example, if you're maybe in an office building and there's only 1 or 2 people in the office and it's big enough to be 6 feet apart, things like that. So say where businesses can open safely, those will be announced on Monday. The second phase will be the cautious phase, which is additional industries opening up, and they'll resume with restrictions and capacity limits. For example, restaurants, that will be, we'll limit it to whatever percentage it will be to ensure that people are 6 feet apart. The third phase will be the vigilant phase, which is additional openings with more guidelines. And then the fourth phase will be the new normal. It's called the new normal because it will be the phase where it's the development of a vaccine and a therapy that enables a resumption with the new normal. So that will be a longer term that we'll see that one. But we'll start seeing phase 1, I presume, by Monday. The numbers, again, are looking very good. So we will see some of this happening starting Monday. And I think, Steve, the reason for some of the confusion that people had is they saw this, they heard us yesterday announce it, and then they saw it in writing yesterday on social media or heard it on the newscast, but didn't really understand, what business can open. I'm getting calls and emails. Well, when can the salon open? When can the restaurant open? That wasn't the point of yesterday's press conference. The point was to get the standards out there, what the phases are going to look like. And then the second part of this were the mandatory workplace safety standards that we're trying to get out to every single industry that will need to be followed. Now, there's 4 of those. One is social distancing. So every industry is going to have to practice social distancing, 6 feet apart, face coverings, et cetera. The second part of the workplace safety standards will be hygiene, regular cleaning of surfaces, computers, et cetera, hand washing techniques. The third safety standard will be under staff and operations, and this is where the training will come in. Discussion about if you have symptoms and the protocols if you have that. And the fourth safety standard will be cleaning and disinfectant, and enhanced cleaning protocols, et cetera. So there'll be some signage around this. There'll be education around this. But that was the point of yesterday, is to get every industry to understand what we've been talking about here in this show for several weeks now. Is be prepared as a business to open up with these new norms that are going to happen. So if you're ready to, if your business is announced or your industry is announced on Monday to open, be sure you have these 4 workplace safety standards in place before you actually open. So more to come on this later in the week from the governor or by Monday of what industries will open. But the indication right now is that it'll be industries that can safely open, that can do this easy enough. Because again, we don't want to see the spread continue. We want to make sure the numbers keep going down. I believe then the following week we'll see more things opening up, et cetera, like they are doing in other states around us. But remember, the numbers are good. They're going in the right direction at this point, which is why I give them on a daily basis. But we're cautiously optimistic that we will be able to start opening on Monday. But again, we need to be careful how we do this to ensure we do not get back to where we were, 3 or 4 weeks ago in the surge.
Matthew Muratore is a Plymouth State representative. He joins us each day along with Selectman Chair Ken Tavares as we try to provide verified information to the Plymouth community with our elected officials as well as with experts in various fields that are responding to the coronavirus. Today we have 9 people joining us on the panel. We're ready for your questions. Tomorrow we'll be here with another special group of people. They include Dr. Christopher Ogilvie. He is the Director of Endovascular and Operative Neurosurgery at Beth Israel Deaconess in Boston. He is a brain surgeon, professor of neurosurgery at Harvard Medical School. He'll be responding to questions regarding elective surgery as well as surgery that should continue and not be postponed. In addition, we welcome back our own Plymouth epidemiologist, Dr. Mark Wilson. He's the active professor emeritus from the School of Public Health at the University of Michigan. Also, our federal partner, Michael Jackman in Congressman Keating's office. Heather Cosby, CPA, Amy Naples will be doing our business segment for the Plymouth Area Chamber of Commerce. At this time, we're going to go to questions. We're going to go back to our town manager, Melissa Arrighi. And Melissa, the question from a viewer that came in today has to do with a re-entry advisory committee. Is there anything that is being formed from the town of Plymouth?
Well, nothing formal that would be formed. I think the schools might be looking at something like that because, of course, their constituent base with the parents and the teachers and the students is a little different. When you look at all our different buildings, the senior center is going to have very different needs when they open back up to the public versus like the 1749 courthouse and town hall. So I'm not sure we would have a sort of a one size would fit all. What we may need to do is collaborate internally with many different groups, including a public safety component, a public works component, as we look at the cleanliness of the buildings and a lot of the 4 tenants that Representative Muratore went through. So we want to have a collaboration of people. I think that's always a great tool. It's who you pick that's important. You want to make sure that you put people on these groups that you're working with, including town managers from other communities that want to work together, that want to collaborate, that are there in a positive manner to find systems and find programs and find methods that will work. This is a sensitive subject as people are afraid and reopening to the public comes into play and makes people worried. So we want to make sure that we have people at the table that know how to work well with others.
Thank you. And that is our town manager, Melissa Arrighi. For our next question, we're going to go to the Recreation Director, Ann Slusser. And Ann, the viewer asks, will there be swimming lessons this summer?
So for swimming lessons, we are hoping to offer lessons. We're looking at different ways to offer them. I've been working with one of our programmers who has an extensive aquatics background with us in the rec department, Holly Coots, at looking at different ways we can offer them, whether it's private lessons, parent-assisted lessons, where the instructor is guiding the parent on how to help the child in the lessons, or semi-private lessons with its children inside the family. It allows us to offer the lessons, but still respect social distancing. Swimming lessons and learning how to swim is a very, very important skill in life that we'd still like to offer.
Thank you. Ann Slusser is the Recreation Director for the town of Plymouth. We're now going to go back to Representative Matthew Muratore. Matt, you give us lots of statistics every day, and a Plymouth viewer asks a question about Plymouth County, specifically that the city of Brockton appears to have about half of the COVID-19 cases in Plymouth County. Brockton's rate is 32 cases per 1,000, the second highest in the state. Can you explain?
Yeah, I think, Steve, the issue is, and it's not just Brockton, you look at Lawrence and Worcester and Boston, and you look at these inner cities, And a lot of it has to do with the closeness of how people live, where their houses are, where their apartments are, and the amount of people in a small area. When you start looking at the statistics throughout the Commonwealth and also throughout the country, there are states out there that like Montana, that didn't get hit as hard because they're more spread out. Your neighbors, maybe, I don't know, a mile away or something. But where you're looking at inner cities, that's the real issue, is a cluster of people and the togetherness of it, and that's why there's more of an issue in the inner cities.
Thank you. Plymouth State Representative Matthew Muratore. Each day we circle back to all of the members of our panel. They've gotten an opportunity to hear from each other on the opening statement, and we'd now like an additional closing statement from each panelist so that we can remind viewers what would be a good takeaway for today. We're going to start with the town manager, Melissa Arrighi. Melissa, you've come back after being in hiatus for several weeks. What do you want viewers and residents to remember today?
I think I want them to know how hard all of us are working, and they've seen it on this show that you and Selectman Tavares have had, and Representative Muratore every day for so long. We want them to take care of themselves, be respectful of others, try and follow all these programs, policies that are coming out of the State House that are put in place, and be careful because we know it's going to be a beautiful weekend this weekend. These beaches, and these are not open yet. We understand people want to get out there. They need to give us more time.
Melissa Arrighi is our Plymouth Town Manager. Next, our Chief of the Fire Department, Edward Bradley. Ed, we all want to support our first responders. What can we do to be helpful as a town?
Well, we've been very lucky during this. We started and implemented a very aggressive and proactive objectives to keep the staff safe, and they've abided by that. And I'm happy to report that out of 215 incidents where we interacted with people that were either positive COVID-19 or suspected and later on tested as positive, we have only had one member test positive for the virus. We've had 7 in quarantine, and 11 members have been tested, and we're waiting just for results on 2 of those right now. So we've done very well because the firefighters have paid attention and changed the way of delivering services, but they haven't slowed down at all. As far as some good news, the North Plymouth Fire Station, that construction project has gone on, and it is still on schedule. We will look to be moving in there at the end of June. And not only is it on schedule, but it is under budget by more than $800,000. So on schedule, under budget, pretty good news. One announcement, though, we have to make is we'll no longer be scheduling or participating in any of the drive-by celebration parades after May 17th, when the state starts opening up next Monday. The parades have been a fun way for us to give back to the community that's been so supportive of our efforts while we battle this pandemic. And while it was uplifting for us to share in the celebrations, it's time for us now to get back bring our focus back to our core mission and continue our training and prepare for that to transition back to our new normal. So we're sorry we can't keep that up anymore. We've got to get back to our regular business.
And that is Plymouth Fire Chief Edward Bradley. We're next going to go to Christopher Smalley, the Senior Director of Marketing Communications. Chris, my wife was scheduled to have knee surgery in Boston this past Monday. Her pre-op appointment was postponed. Her surgery was postponed. Tomorrow we're going to happen to have my brain surgeon on the program, and he's in Boston. What's happening on the Plymouth campus with respect to elective surgery as well as procedures that are necessary and not elective?
Sure. So, and thank you to Dr. Chris Ogilvie at Deaconess in Boston, as well as your brother, Phil, for everything that they've done on this show. Locally at the hospital in Boston, any elective procedures or surgeries have still been postponed as we begin to look at how to slowly reopen various aspects of the hospital, including elective surgeries. That's something that we'll look at over the next couple of weeks, like everybody else on this panel, for how the town reopens. If somebody needs an emergency situation or surgery, our ORs are open and we do perform emergency surgeries as needed. There are lots of safety measures in place. I've said this on past shows. Specific to the emergency department, as Representative Muratore mentioned earlier, we do have capacity, meaning we have beds available in the hospital should there be an emergency surgery situation, or if someone comes to the hospital with an emergency and they need to be admitted as an inpatient. We do have the capacity to do that in a very safe environment where we screen COVID patients away from the non-COVID patients. So that's what's happening locally. We'll have more information in the coming days and weeks as our system, Beth Arrighi Health, as well as our local hospital here in Plymouth, Beth Arrighi Plymouth, looks at how to slowly phase in those procedures that you were mentioning earlier.
Thank you, Christopher Smalley. He is the Director of Marketing and Communications, Beth Israel Deaconess here in Plymouth. We're now going to go to Tom Marr. He is the Airport Manager. And Tom, what do you want our viewers to remember about Plymouth Airport?
Thank you, Steve. I would like everyone in the town of Plymouth to understand that if you hear a helicopter at 2 o'clock in the morning, it is going to be the state police or the med flight most likely. And they're going to continue their operations throughout this health emergency. And we certainly appreciate all the effort that those two groups do to help protect us.
Tom Marr is the Airport Manager for the airport in Plymouth. We're next going to go to our Recreation Director, Ann Slusser. Ann, we're all hopeful to be able to do more exercise, more recreation in the coming weeks and months. What can you tell us?
Thanks, Steve. So are we. We love interacting with the public in our classes that we offer. So, check out our website. We do plan on posting our classes, hopefully by the end of the month, that we will be offering this summer. Unfortunately, you won't see the program guide mailed out like we have in the past for the spring and summer programs. You will be able to download a version of it on our website once all of our programs have been put together. But definitely check out our website. It's plymouthrec.com, or our Facebook page to see activities that you can partake in at home, ways to keep kids busy. And anybody that wants to view our positions, we do have open for seasonal staff. You can definitely check them out on the Town of Plymouth website under the Human Resources tab.
Ann Slusser is the Recreation Director for the Town of Plymouth. Michelle Brady is the Director of Elder Affairs in the Town of Plymouth. Michelle, on Mother's Day, I was speaking to my sister-in-law. She is the Assistant Director of Elder Affairs in the Town of Lynnfield. And I have to tell you that they're doing a lot, but yours seem to be doing a lot more. I told her about your idea of calling people on their birthday, and she's going to take that and run with it and implement that in Lynnfield. So thank you for that idea. And what can you tell our viewers today?
Well, thank you for that, Steve. I think, I will say that this community of council on aging directors, facilities, we really do come together and share ideas. And I think it's a really positive, uplifting thing. So I'm sure I'll be receiving great ideas from Lynnfield as well. I guess two things. I just want to say to the seniors in Plymouth, thank you. I think that you have done a phenomenal job showing me and my staff, and hopefully the community, maybe you don't see it, patience. They are the most isolated group, and rightfully so, in terms of being safe and kind of practicing that true social distancing. And we as a community really need to be proud of them and really acknowledge their sacrifice. They know they have to stay safe, and they know that they have to take this seriously, and they're doing it. And I just commend them for, I may go stir crazy at times, but I may have a little more freedoms moving around than they do. And I just think that they're a testament to how good our community is and patience. Also, just wanted to let people know that on a side note, first of all, thank you, Chief Bradley, and to the fire department for our temperatures every morning. It's seamless. So happy to be back in our Center for Active Living building on the revised schedule and practicing safety measures. But it is a thrill. It's an honor to be back in my office, quite frankly, and my staff feel the same way. The Center for Active Living, the front of the building, a picture is going to be on Chronicle Thursday evening. They asked to borrow a picture of our beautiful center on a story that's not related to COVID or anything significant, but we were happy to do so. So we might see us on Chronicle. Thank you, Steve.
And that is Michelle Brady. She's the Director of Elder Affairs for the town of Plymouth. Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. Steve, we'll be seeing you again on Thursday, but what do you want us to remember until then?
Well, it's really all about confidence. I mean, these guidelines that are being handed down by the state and being adopted by the community are largely intended as a business development scheme. And I mean scheme in the polite British sense, not the underhanded American way. It's intended to inform businesses the things they need to do in order to be successful given the existing climate. And so with that confidence, I feel more confident in having answers to the kinds of questions that Matt had already proposed. Coming from this opening advisory board are things like, to what extent can an activity accommodate social distancing? Can the employer provide face coverings where appropriate, as well as sanitation and hand washing stations? This is information that is going to help me and others make informed decisions and thereby feel confident we are making the right decisions. So pay attention to the show. I think that anybody who's been watching certainly is probably among the most well-informed in the Commonwealth. And I would say that, if work were so pleasant, the rich would keep it for themselves. We're going to have to work real hard to make sure that we come through this well and successful. The foundation is here. We have great partners with the Chamber of Commerce, the EDA, the SBA. There's no shortage of arrows in our quiver. It's really just a matter of knowing how to respond. So if you are experiencing a hardship, or you're encountering someone or a business that is experiencing kind of a hardship, or you're familiar with a particular impediment, please let us know and we will work toward a solution. Thank you, Steve.
Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. Representative Matthew Muratore is with us each day. Matt, we started this on the daily updates 43 times before this. And early on, we were talking to the community about what we need to anticipate as we close during COVID-19. Now we're responding as we're beginning to look at some opening across the state. What do you want our viewers to remember today?
Yeah, it's amazing, Steve, that, it's 43 times. And I look at this, and every day I'm with you and with Ken. And of course, Ken and I served on the Board of Selectmen together. And I think we overlap by a year or so. And I think we've worked together more the last 2 months than we did that 1 year on the board together. But it's been a real pleasure, coming on. For me personally, it's been therapeutic. I think initially we all had anxiety, and I know I did, and some sadness and wondering what's going to happen. And this has somehow given a purpose for me personally. To give information that's credible information, up to the minute information to the folks of Plymouth. And looking at the panel today, it's a godsend what we have in this community. We have great leadership, great employees in this community, a great community hospital, and it's been nice to be with everyone and in this together, providing the information. I do want to say one thing in closing. Ed, you have nothing to apologize about. The service that you and your men and women and the Chief Oteri and his men and women have provided to this community in these celebrations has been nothing but heroic. Never mind the work that you do day in and day out, but what you're doing for these, particularly these children, for these birthday parades. And I was a recipient of one of those with my 14-year-old daughter, who doesn't get so emotional, but and didn't want it because she saw some of her friends doing it, but got very emotional about it. And you don't know how much that means to people. So nothing to apologize, Ed, for that. So we appreciate what you're doing. So with that said, I think we have come a long way in 43 days. We've seen the lows and the highs, and now we're seeing the downward trend. We're seeing the light at the end of the tunnel. We'll continue to do this for a few more weeks until we really get a better understanding of what actually is how this is all going to work. It's going to be a new normal for all of us in every single industry and everything we do in this community. So, but we will do this together. A couple of reminders too, the Red Cross is still looking for blood. So if you can give, and they do it safely, please contact the Red Cross. And also from the governor and lieutenant governor, if you are receiving a call that says COVID MA on your phone from an exchange of 833 or 857, please pick it up. That's the contact tracing that we need to do. About almost 20,000 people have been contacted so far, but half those people are not answering their phones. So it's important that you answer your phone if you see that. It takes a few minutes to ask some questions about the contact tracing, who you've been in contact with, et cetera. It did help when I was looking at the numbers for the town of Plymouth today. 7 of those additional cases came from the contact tracing. So that's how we were able to find out who else actually had it. So please pick up your phones when you do that. And again, thanks to all those employees who are taking care of our physical health and all those people out there that are taking care of our economic health. Again, stay informed by going to mass.gov/COVID-19, or if you have questions, call 211. There's been over 20,000 calls to that line so far. If you want to get text alerts, which is the best way to get information, particularly when the governor is going to be speaking, and today it'll be 1 o'clock, you can text COVID MA to 888-777, or in Spanish, it's COVID MA ESP to 888-777. And if you have questions on your health, it's Bowie Health /mass. And again, just stay calm, stay home. Again, you're saving lives, even if you're just staying home. And remember, the more we come together by staying apart, the faster we'll get back to the people that we love and the things we love to do. So thanks again to you, Steve, and PAC TV, and we will see you tomorrow.
Thank you, Plymouth State Representative Matthew Muratore, and he talked about the communication among our participants. And while I've always enjoyed a good working relationship with the Selectman Chair, Kenneth Tavares, and our State Representative Matthew Muratore, I think we've spent more time, at least more often, in contact at least 5 days a week and sometimes 6 or 7. So as you can see from the people participating here, they Zoom in each day, usually 15 minutes in advance for voice and face checks, and yet they often have a chance to get some business done and to chat with one another. So this has been a great opportunity for everybody to be communicating. I want to thank all the members of the panel. Melissa Arrighi is our town manager, Edward Bradley, our fire chief, Christopher Smalley, the senior director of marketing at Beth Israel Deaconess, Thomas Marr, the airport manager, Ann Slusser, the recreation director, Michelle Brady, director of elder affairs, Stephen Cole, executive director, Plymouth Regional Economic Development Foundation. And we're going to go back now to the chair of the Board of Selectmen, Kenneth Tavares. Ken, what do you want us to remember?
Thank you, Steve. A couple of housekeeping items. First, tonight, the Board of Selectmen will be meeting at 5 o'clock on PAC TV. We will continue our meeting dealing with the budget and articles. Also, the police chief will be on tonight talking about distancing and masks. So we have a full evening this evening starting at 5 o'clock. Also, I want to remind you, excuse me, that we need to answer the call from the town clerk if you can volunteer some help. And as I said, yes, it's not actually even all volunteering. You will be paid for your services. Please call Larry in conjunction with the election at 508-322-3302. I'd be remiss if I didn't take a minute to say thank you to all of the town departments. We have 5 of them represented here today. Our employees have been outstanding. No one gave us, as I've said before, the playbook as to how we were going to respond. But I think our employees have come forward, they've done their job, and we are extremely proud of each and every one of you. To Steve and Matt, thank you. You're right. We have spent a lot of time together. I remember when we talked about doing this program, not knowing whether anyone would watch it, but I think we're providing a service where we're getting the information that needs to be out there in the format that it needs to be in. To end my comments, change is certain. We talked about this yesterday. That is the constant. That's where we're going. for the next several weeks, but I think under the leadership of the governor, the Commonwealth is starting to walk out from underneath this horrible virus. Thank you, and we'll see you tomorrow.
That's Kenneth Tavares. He is the chair of the Plymouth Board of Selectmen, and we thank Ken, Matt, and all of our guests today. And looking to tomorrow, again, Dr. Christopher Ogilvie. He is a brain surgeon at Beth Israel Deaconess. Dr. Mark Wilson, he is our Plymouth epidemiologist. Michael Jackman from Congressman Keating's office. Heather Cosby, a CPA in Plymouth. Amy Naples, the executive director, Plymouth Area Chamber of Commerce. Thank you to everyone for joining us today. I'm Steve Triffletti, Plymouth Town Moderator. Good day, and thank you.